Hi, I'm Dr. Connie Casebolt-Carver, and if you're watching this, it's because either you or a loved one is concerned about or maybe has been diagnosed with having cancer. So the first disclaimer I want to make is that I am board certified in family medicine and I do not make any claims about treating cancer. However, I do have some strategies that I can help you with to where you can empower your own immune system to get healthier. So over the next few minutes, we're going to discuss a few things that you and I can work together on to make sure that you optimize your immune system and your chances of getting healthier. The easiest fix is vitamin D. In order for your immune system and your natural killer cells, those are the white blood cells that fight off infection, in order for them to be optimized, you've got to have a vitamin D level between 80 and 100. So that's an easy fix. Make sure your vitamin D level's checked. We can do it here at the office, and then we can teach you very quickly how to get your vitamin D levels up. Number 2, diet. It's been proven many times through epidemiologic studies versus a study that I'll describe in a minute, that a diet rich in fruits and vegetables, beans, whole grains, nuts, in other words, a plant-based diet, is far superior to an animal-based or a junk food diet. So we all know that sugar feeds a cancer. What you might not know is that animal foods also feed a cancer. If you want any more conviction on this or information, I would urge you to go to nutritionfacts.org. It is searchable. Type in cancer and diet, or eggs and cancer, or chicken and cancer, or red meat and cancer, anything along those lines, and you will be presented with some firm, hard evidence. Case in point, they took blood from vegans and put it in a petri dish with cancer, and the blood from people who are eating only plant foods was 8 times more effective at killing cancer cells versus blood from people eating animal products. So you're going to want to make an immediate dietary switch, get rid of processed foods, that's oils and sugars, and that's animal foods, and eat only unprocessed plant foods. You can consult various websites. There's Hallelujah Acres. They have a website that gives some information. There's eatplant-based.com. There are recipes, and on that website there are actually local classes where an expert in plant-based nutrition teaches you how to implement this into your ordinary life. Another great book on that is How Not to Die. There are several chapters on cancer in that book, How Not to Die by Dr. Greger. Okay, other than diet and vitamin D, what else can you do? Well, it turns out that beta-glucan, which is an immune stimulant derived from mushrooms, actually empowers your natural killer cells. So it's a simple thing to do, 500 milligrams once or twice a day to keep your immune system healthier. Now, many of you may have found out about our office because we do some IVs, specifically high-dose vitamin C. So vitamin C, when you ingest it with food, is known as an antioxidant. But when vitamin C is given IV, it actually functions as a pro-oxidant, which you might think is harmful, but oxidative stress is one of the mechanisms by which your immune system kills cancer. So vitamin C IV has actually been studied in clinical trials. In fact, you can look on the internet and find some evidences of vitamin C IV. And by high dose, we mean anything between 25 and 100 grams IV. So we can give a dose of 25 grams of IV on your first visit. However, in order to qualify you for higher doses, it's mandatory that we get a test called glucose 6-phosphate dehydrogenase, or G6PD for short. This is a fairly common genetic disorder, and it has to do with how well your body can handle high-dose vitamin C. If you don't have adequate levels of this enzyme, then high-dose vitamin C could potentially, in fact, very likely cause hemolysis, i.e., destruction of your red blood cells. That would be a medical emergency that would necessitate a trip to the emergency room. So we do not do vitamin C in doses higher than 25 grams without checking that first. as a precaution. And yes, we have found a few patients who have that. It's specifically higher in African American men. They have the highest risk of having that enzyme defect or that genetic defect. A couple of other considerations you might want to consider. Heavy metals have been shown to be implicated in cancer. So people who have a higher total body burden of heavy metals such as lead, arsenic, cadmium, have a higher risk of developing cancer. This is one of the mechanisms by which smokers have higher rates of cancer. It's due to the accumulation of the cadmium, the lead, and the other heavy metals. So you might want to consider being tested for heavy metals, and if we find that, that is something we can help you do. Come up with an effective strategy to help you start ridding your body of heavy metal toxins. Also, non-metal toxins can also affect the immune system. We have a very good test through Great Plains Laboratories where we can assess your body of non-metal toxins. So that's also an option. Something else you may not be familiar with, but root canals can actually play a role in the development of cancer, and here's why. There's something called energy meridians that run through your body. So meridians are flows of energy, and that's why acupuncture is effective. When an acupuncturist is using a needle and she or he is inserting it into different points in your body, it's actually improving the flow of energy through that meridian. It turns out that all meridians go through the teeth. Why is that important? Well, if you have a root canal tooth, that tooth is now dead. Over 90% of root canal teeth have hidden infections deep inside the tooth. Every tooth has between 2 and 3 miles of microtubules that, when the tooth was alive, furnished as the circulatory system of the tooth. It kept the tooth healthy and nourished. Once that tooth is dead, and all root canal teeth are dead, those 2 to 3 miles now serve as a reservoir for anaerobic bacteria, who can now drip toxins into your system, and they function as circuit breakers. So when a meridian is coming up and going through a tooth, if that tooth has a root canal in it, it can function as a circuit breaker, meaning the energy cannot continue to go and flow through that meridian system. I know that sounds like a lot of woo-woo or unconventional medicine, but trust me, I have seen people improve when they got their root canal teeth pulled. You're going to want to go to a dentist knowledgeable about that, and the International Academy of Metal Toxicology, I believe that's IAOMT.org. That is the website where you can find dentists who are certified and know about the dangers of metals in the mouth, such as mercury fillings, root canal teeth. So you're going to want to find a dentist that understands that and will help you take care of that problem. So, with all that being said, I am certainly happy to assist you in your goal of becoming healthier. Again, keep in mind what I said at the beginning of this video. We do not claim to treat or cure cancer, and we will have you sign a paper showing that you understand that. But we can help you in as many ways as we can think of to help you improve your immune system so that you emerge from this ordeal, hopefully, healthier. I wish you the best of health.